A chronic disease is an illness that requires ongoing medical care that lasts at least 1 year and limits daily activity. Chronic conditions are becoming more common in the United States. The highest portion of the population to suffer from chronic conditions are age 65 and older, and these conditions do increase the risk of negative outcomes such as disability. There are many chronic conditions, but here are a few of the most prevalent: cancer, arthritis, diabetes, heart disease, and HIV. While cancer can fall under the category of a chronic condition, many people are also more susceptible to cancer when they already have one chronic condition. Multiple chronic conditions can be difficult to juggle because the treatment options might not work well together. It's important that patients inform all of their doctors to which therapies and treatments they are receiving. People who have a chronic condition and a cancer diagnosis have numerous concerns. It's important that they have access to information in order to stay educated on their conditions. These conditions may impact their ability to care for themselves and their overall quality of life. They will also need to make a number of cancer treatment decisions as they move through the process. It's important that patients discuss options and possible side effects with their doctor before starting any therapy. By working closely with medical providers, patients can make informed decisions on what works best for them. Beating cancer is not always the end of the story. Many patients experience late effects of cancer treatments, which means that they may see some lasting side effects or changes in their bodies that occurs months or years after the treatment has been completed. The late effects don't impact every patient, but there is a risk that's more prominent with some people and various forms of treatment. With chemotherapy and radiation, late side effects might include health-related risks, such as issues with the heart or lungs. Patients also may experience compromised digestive systems or irregularities with specific organs. Some patients experience dental issues or diminished hearing or vision. These late effects might begin within a few months or even several years after the therapy has ended. Late effects from surgery often occur shortly after surgery and might include infection. With some forms of cancer treatment, patients may experience cognitive late effects, such as problems concentrating and issues with memory. There are also several emotional issues which many patients report after they've gone through cancer treatment. These issues might include depression, anxiety, fear, and sudden anger. Depending on the type of treatment, some patients may be more likely to developing a second type of cancer. To reduce your risk for chronic conditions, there are a number of lifestyle changes you can employ, such as quitting smoking, being physically active, and following a healthy diet. It's also important that you have access to resources about the condition you suffer from and known secondary conditions to be aware of. Education and access to regular health care are your best protection against future illness. Cancer is not something that can be eliminated completely just by treating the patient. It's important that communities as a whole are educated and support the effort to remove risk factors.